What's up, everybody? Welcome back. Today we are gonna go through our second series of why am I walking like a 90-year-old, having that back where you just kind of bent over, nice walking, can't quite straighten up. This one's gonna focus a little bit more on what happens if you have that pain down the leg. Also, lots of things that can cause that pain down the leg. We're not gonna go through all of those, but kind of those sciatica-like symptoms. Sciatica means that the sciatic nerve is pissed off. It is not telling you why it's pissed off though. But if you have some back issues, make sure you go through part one of this before you get to part two. This is really gonna go through more of those peripheral symptoms and trying to loosen up that nerve path that is going down the legs. So we got a couple different ways to do this. One of those is not gonna be stretching out your piriformis. Definitely can do it. If it's giving you relief, it's helping out, go for it. But we're gonna focus on actually calming things down and getting that nerve path to loosen up, not just getting rid of some of those symptoms. So starting off with a lacrosse ball, we are going to go onto chair, couch, anything. Gonna need to be a little bit of a firm surface just so that you can get a little bit of pressure into the hamstring. What we're gonna go after is we're going after that sciatic nerve path that is going down through those hamstring muscles. If that nerve gets stuck onto the hamstrings, as the muscle fires, it tries to take that nerve with it. That can aggravate the nerve and cause some of those increased symptoms, not necessarily making anything any better. We're not trying to necessarily stretch out the nerve. We're just trying to get it to release from the muscle so that it can slide better and glide better. That different movement, that allows more movement to happen as we move, which makes us feel better. So we're using that ball to just do this pin and stretch, and we're using that little kick out to try and stretch that nerve along as we're moving the muscle to try and get it to just loosen up and get those fibers to let go of the nerve as we are moving. You're gonna move spots pretty consistently. You don't wanna sit there and hammer on one spot a lot. Nerves are very sensitive. If you do too much of this, it will piss off the nerves. So you're looking like 2 to 3 little kickouts per area. Go ahead and move it. If you want more pressure, you can lean forward and actually push on the leg. That's gonna give you a little bit more pressure. Your nerve is really pissed off, you need less pressure. You can lean back and just nice and easy, just add that little kick out. You can do this with the calf as well. If you're on the ground, just put it into the calf. At that point, you're just gonna be moving ankle to try and get it to loosen up within that calf area, not just in the hamstring. That sciatic nerve runs down to about just above the back of the knee, then it branches down, but that nerve runs all the way to the toes, all the way up to the back. It's that one structure that is that common link all the way through. Next one we're gonna go through is just a nerve glide. Just nice, easy, simple way that you can do throughout the day just to try and improve that nerve flow. Big thing is we're trying to move at least 2 segments, but we're moving them opposite. So as we're here, we're gonna straighten out the leg, which is gonna tighten up the nerve, but we're gonna point the toes, which is gonna take pressure off of that nerve further down. As we bring the knee in, we're taking slack off the nerve at the knee, but we're adding it at the ankle by bringing those toes up. So nice and easy, do it about 10 to 15. You can also do this on your back and add a third joint, add that hip movement in to help out. If you wanna wind up spinal cord, you can have horrible posture, slouch, and that'll add increased tension through that nervous system as well. If you do a nerve stretch, which is not recommended to start off with, you're gonna be bringing toes up as well as the knee, and that's gonna be more of a nerve stretch. That is the aggressive version, but that can piss off the nerve. So be aware of how much you are doing, and if the nerve does get pissed off a couple hours later, it's probably gonna be from that. So make sure that you kind of adjust and adapt what you're doing based off of symptoms 2 to 3 hours later in the day. Next and last one we are gonna go through is some sort of percussion instrument. This is the Hypervolt. I like this one personally the best, but there are the other ones that are out there. Vibration typically calms down the nerves. But the way we are going to use it is not necessarily percussion. We're going to try and go a little bit more at an angle to add a little bit more of a vibratory sense into that nerve to try and get it to calm down. So we're just going more across the nerve. We're kind of angling it across the skin and just trying to go through wherever you kind of have that nerve sensation, whether that's outside of the leg, down the back, you can have it down the inside. Those are the three big areas of the nerve that are going down. Also, right in the middle of the sciatic nerve with that hamstring. I would work full nerve path going from glutes, kind of working your way all the way down into hamstrings and then going into the calf. That should take anywhere from 3 to 5 minutes depending on where you're going. But again, I really like having that angle, getting a little bit more of that vibratory sense as opposed to percussion. If you dig into it too much with that percussion, same thing, it can piss off the nerve. So just be aware of how hard you are going into the nerve. The nerve is pissed off, you hit it a bunch of times with a percussion instrument, it's going to hurt. It's kind of like poking a bruise. It's gonna hurt. So be aware of how much you are going, how hard you're going, especially with any of those percussion tools. But it's really good if you use them correctly to help calm down those nerves and get everything moving the way that you want them to. Try those out. Again, make sure you look at part 1 of this. Really calm down that back first. That's where all the symptoms are going to be coming from that are going down into the leg. Fix this first. Make sure you calm this down. That's going to be the best way that you can treat and help yourself out if you have any of those sciatic-like symptoms. If you like this video, make sure you like and subscribe our YouTube channel. Drop us a comment. Let me know what you think. And then also we can keep these videos coming. Make sure that you live that active, healthy lifestyle that you want.